Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. In the previous weeks, we discussed about infancy. So this time, as soon as your infant is born, what do we give them in the hospital? Well, nothing but vaccines. So we would be discussing the vaccines. BCG, OPV and Hep B are given immediately after the baby is born, even before the baby has left the hospital. So what are these? BCG is given for preventing complications of tuberculosis. So the first doubt that comes to your mind is, okay, I have vaccinated my baby. This BCG has been given even since I was a child, but still I see so many cases of tuberculosis. So what's the point of me giving this vaccine? Well, this vaccine is given to prevent the complications of tuberculosis. So, if you go back when you were a child, you would have seen a lot of TB related deaths, but you no longer see. That is because the tuberculosis spreads to the brain and different organs of the body, causing death. This no longer occurs because we vaccinate them. We vaccinate them at the infancy itself so that they develop immunity over a period of time. No doubt they might develop tuberculosis infection later on if they don't use mask and they're exposed to someone who has tuberculosis. But definitely it can be treated with medications and it will not spread to the other organs and it will not result in death. The second vaccine that we give is OPV. As kids, we would have seen a lot of people who have been affected with polio attack. They might be having a limb deformity or they might be having a little bit of stiffness or something, but we no longer see it. When we ask their family, they say that they were affected by polio. We no longer see it. That is because of oral polio vaccine that we are giving. So why is this oral polio vaccine important? The biggest benefit of giving oral polio vaccine is not only to benefit your child but also to benefit other kids. So what do I mean by that? Let's say you're in a community where 9 of the kids are vaccinated and the 10th kid is not vaccinated due to whatever reason. This virus is transmitted through fecal-oral route. So is the vaccine. So what happens is when you give this oral polio virus vaccine, it basically helps in spreading the herd immunity. That is the 10th child who has not even been vaccinated, because he or she is playing with the other kids and they use their hands and they touch the different fomites. What we call as fomites is basically the objects that we all touch. So this other child is also exposed to this vaccine just because your child is vaccinated. So the whole community is protected against the polio virus. There is another vaccine that is available for polio called as the injectable polio vaccine. Here your baby is getting better benefit. So even for the kids whom we give injectable, we do have this pulse polio project during which we come home to door every home and we give the polio drops. The reason is only to spread herd immunity, thereby eradicating it completely from the community. The third vaccine that is given immediately at birth is hepatitis B. Hepatitis B vaccine is mainly given to prevent hepatitis B infection. Hepatitis B infection spreads by blood. So let's say the mother is infected with hepatitis B, or whatever was the object that was used while delivering, if it was stained with, or there is some cross contamination which has resulted, we can prevent the infection in the baby by giving the baby hepatitis B vaccine. If the baby is born to a hepatitis B positive mother, then the child would be given an extra immunoglobulin as well to prevent the infection. This is basically a disease that involves the liver, causing liver failure. It is one of the easily preventable causes of liver failure. Hence, we vaccinate the child. As the baby grows a little older, we give the babies other vaccines like DPT, that is diphtheria, which involves the throat. It causes spasm, tightening of the throat. This can become fatal. That is, it can result in death as well if it is not prevented or treated at the earliest. Pertussis is called as the whooping cough, where they have bouts of cough continuously in the infancy. This can result in death in the baby. By God's grace, we no longer see this because the kids are vaccinated at the earliest. Tetanus is again an infection that causes a spasm, that is tightness of the muscles. If it causes the tightness of the respiratory muscle, then the baby can die immediately. In order to prevent these diseases and their complications, we give the kids DPT. Apart from this, we also give rotavirus. So here the rotavirus vaccine is basically given to treat a condition that is caused by rotavirus. So what does rotavirus cause? It causes diarrhea. We have a lot of mortality, that is infant death and under 5 death because of diarrheal diseases, and rotavirus is one of the most common infection. So when we give this, then definitely we are preventing the mortality due to diarrheal infection by a paramount amount, by many folds, multifolds. So this is a simple oral drop that is given to prevent the rotaviral infection. Apart from this, we also give the kids Hib. Hib basically is Haemophilus influenza. So this is a virus which will cause a respiratory infection. So that respiratory infection spreads faster and it can be life-threatening as well, resulting in respiratory distress. That is, the child will all of a sudden develop respiratory failure because he or she is not able to breathe due to this viral infection. So in order to prevent it, we give this vaccine. Apart from this, we also give another vaccine that is for pneumococcal infection. Pneumococcal is a bacteria. So this is given to prevent a respiratory infection that is caused, and meningococcal is to prevent the brain infection that is caused due to the bacteria. So again, this can result in severe pneumonia or severe brain fever, which results in death of the baby. So by giving this, not only does it protect in the childhood, but also as the child grows ages, it helps in giving better immunity and to cope up with any pneumonia or brain fever related infection caused by these organisms. Apart from this, MMR, that is measles, mumps, rubella. Measles, we all know, is the rash that we have, that the child has in the infancy, which can not only cause death but also results in infertility and other complications. Mumps is parotid gland infection, which can again result in sexual inability, that is infertility. And rubella again presents with rashes. So all these rash related infections can be prevented because these not only cause life threatening complications, but also it causes disability later on in the child. So hence these are given. These days, we also give children the chicken pox, that is varicella. So, varicella chicken pox can later on, when you get a chicken pox infection, later on it stays dormant and cause a condition called as shingles. So these days you have heard of above 50 years being campaigned for Shingrix vaccine. Well, exactly to prevent that complication and to prevent the infection from spreading, from the rashes from occurring, we give the children this vaccine. Apart from this, we also give them typhoid vaccine to prevent the complications that are related to typhoid. We all know typhoid is related to the gastric system. Either they present with diarrhea or constipation, or and they have long-term fever. But the complications of typhoid includes perforation. It can even cause a life-threatening perforation, means basically damage to the walls of your gastric system, resulting in bleeding. So this can cause either the biliary content, that is the content of the gastric system, to spread inside the abdomen cavity, resulting in infection, sepsis and death, or it can result in bleeding, resulting in death. Either ways, to prevent all these complications and to keep the infection to the mildest possible or completely to avoid it, we give the typhoid vaccine. The pneumococcal vaccine PCV, we have different brands. like Pneumo 23, we might have Prevenar. So depending on the brand, your doctor will tell you the schedule that you will have to follow. And apart from these, whatever vaccines I have mentioned, no, they can come as a combination like Pentaxim, Hexaxim, to reduce the number of needle pricks that the baby would be requiring. And the booster dose doesn't have to be the same as what you had given. Let's say you had given your baby DPT, but later on, as the baby is above 5 years of age, he or she might just be getting a Tdap, that is only a particular, since some of the diseases don't occur after 5 years of age, we will be restricting the component and we won't be giving all the components of the vaccine. So the boosters might vary. Apart from this, when your child, let's say that you have a girl baby and the child is nearing the menstrual age group, then your doctor would advise for HPV vaccine. So again, we have different brands like Gardasil, etc. So based on the brand that they choose, they would be having the schedule, either 2 doses or 3 doses. And when we talk about vaccines, certain things that we will have to remember is you have to know when to vaccinate the baby. So you will have to follow the schedule and you will have to talk to your doctor. Second thing is about the side effects that you can expect. Well, your baby is going to have fever, your baby is going to have pain. So what are the things that you can do to the baby? Well, immediately you put a cold pack as soon as you go home. If the baby is being breastfed, give frequent breastfeeds, no issues at all. If the baby is on complementary feed or the baby is slightly older and is refusing feed, it is absolutely normal for the first 2 to 3 days after vaccination. For the pain, you can definitely give the baby paracetamol. There is no issue at all. Apart from this, for the body pain, baby, you can again give paracetamol. Some people ask us whether they can shower the baby after the vaccine. There is no problem at all. Baby can have normal showers just like usual. And is it common to notice swelling? Yes, it is common to notice slight swelling, and cold pack and is all that is required, and the painkiller is all that is required. Is fever common? Yes, of course it is common. So that is why we suggest you to give the baby not only for pain but also for fever. We ask you to give paracetamol. Should you label, should you keep the tag or stick to it, to the chart? Yes, as soon as the vaccine is given, you can ask your doctor for the tag, which contains the batch number, it contains the name of the vaccine that is given, whether it is Hexaxin, Pentaxin, so that you don't have to give the baby the same injection again. And apart from these things, what all should you notice? If the baby is having excessive seizure, that is involuntary movement of the limbs, or the baby is having frothing from the mouth, extremely drowsy, baby is throwing up, vomiting repeatedly, or the baby's fever is not subsiding at all, baby is becoming unconscious, lethargic, then you have to go to your doctor. At the site, if you're noticing any abscess formation, that is any pus collection in the area where the injection is given, the redness doesn't subside even after 3 4 days, then definitely you have to go to your doctor and alert immediately. I hope this video was useful. I would be meeting you with many more interesting videos. To get regular medical updates, follow me.